Hi, everyone. This is Dr. Meredith Williams from the Capacity Collective. In this video, we will show you how to score the Best Starts for Kids Culturally Responsive Measurement Tool, Protective Factors, or the CRMT-PF. We will call it the CRMT for short. It was created by the Capacity Collective and the King County Best Starts for Kids initiative, and it was tested and validated in diverse communities across King County, Washington. If you aren't already familiar with the CRMT, you will want to learn more about it by watching the video Introduction to the CRMT-PF. In the next few minutes, we will discuss how to score sections of the CRMT, both for individual families and for groups of families. Let's start with the basics on how to score the CRMT. Note that along with the tool itself, the Capacity Collective and Best Starts for Kids have created a scoring workbook. It is an Excel workbook that helps you score individual families or groups of families and can be used to calculate scores one time or over time to measure change. You can download it with the rest of the CRMT resources at the BSK blog. There is a QR code at the end of this video, or look for the link in the video description. The CRMT is scored in sections. For example, these are the questions that make up the family resilience section of the tool. All of the protective factor questions on the CRMT are on a scale of 0 to 4. For most questions, 4 is the score for strongly agree, and 0 is the score for strongly disagree. So a higher score means a higher level of that protective factor. In this example, our caregiver has answered all 5 of the family resilience questions, with responses ranging between a 2 and a 4. Note that we recommend only scoring a full section if you have at least 3 responses in that section. Because the questions are meant to work together, it may be misleading to consider 1 or 2 questions to be representative of a whole protective factor. The answers to those individual questions may be helpful, but the section average will not be meaningful. How you score this section is to add up the value of each of the questions in that section. You can see these scores along the right side of the table. Added together, this caregiver scored 15 total points for family resilience. The next step is to calculate the average score for this section. You take the total score, 15, and divide it by the number of questions that the person answered. In this example, that is 5. That gives you an average of 3. So this caregiver's family resilience score is a 3 on a scale of 0 to 4. Some of the questions are reverse coded. This means that a strongly disagree response is actually a more positive response, so it gets 4 points, while strongly agree gets 0 points. For the knowledge of parenting and child development protective factor, seen here, the first 2 questions are reverse coded and the last 2 questions are coded regularly. You will want to make sure you score accordingly or set up your system to score that way. Here again is an example of a caregiver's scores. They answered all 4 of the questions in this section with lots of 1 and 2 responses, but some are reverse coded and some are not. As with the other sections, you will add up the score for each question to get a total score. This caregiver has a total score of 6. What you're looking for is the average, so you'll take that total score of 6 and divide it by 4 for the 4 questions that were answered. This caregiver's average score for knowledge of parenting and child development is a 1.5 on a scale of 0 to 4. The next 2 sections have a special type of question that impacts the way you score them. For social support, seen here, the final question is a select all that apply question about who the caregiver has to ask for advice about various topics. As you can see, they could select up to 5 different options, or they could select none of the above. When you administer the survey, you ask the question and select all of the options that apply to that person. In this example, the caregiver has selected stress or worries and caring for their child. That is 2 of the 5 potential options. How you score that question is based on the number of items checked. In this case, the caregiver scored a 2 as that has been designated as the score for selecting two options. As you can see, the more people the caregiver has in their social network for people to ask advice, the higher they score on that question. As with the other sections, you calculate the total score for the protective factor by adding up the individual scores for each question. In this case, the total score is 10. To calculate the average, you divide that score of 10 by the number of questions answered, 5, to get an average score of 2 for the social supports protective factor. For the concrete support section, note that the first statement in the concrete supports is reverse coded. Next, note that you have two different select all that apply questions, one about what the caregiver was not able to afford in the past month, and one about financial sacrifices the caregiver has had to make in the past year. On that third question, about affordability in the past month, there is an option for other. This is for caregivers who, in the past month, were unable to pay for something significant that is not on the list. That counts as a checked item. As with the social support section, you select a response based on the number of options selected on those two questions. For the month question, you would select 1 for having 3 items checked. For the year question, you would select 3 for having only 1 item checked. Just like the other sections, you calculate the total score for the protective factor by adding up the individual scores for each question. The total score is 7 in this case. To calculate the average, you divide that score of 7 by the number of questions answered, which was 4. This gives you an average score of 1.75 for the concrete supports protective factor. Once you have completed all of the sections your program is using, you can look for the family's overall average. In this example, the family completed all 5 sections, including the parent, caregiver, and staff relationship section. The family's total score is a 15. To calculate the overall average, similar to what you did in the individual sections, you take the total score, and this time you divide it by the number of sections answered. For this example, the total score of 15 is divided by 5 for all 5 sections for a family protective factor score of 3. So far, we have been talking about individual families and how to score for them. Now let's talk about looking at scores as a group. You could do this for your caseload to see how you're doing with your families, or perhaps your program will look at all the scores together for the whole program to see how all of the families are doing. This is where you can demonstrate impact, looking at your program averages for clients who are starting the program, then looking at the program averages for clients who are exiting the program. Change over time can demonstrate your program has had an impact on one or more protective factors. For example, we have 4 families here. Across the top of the table, you will see the different protective factors. So for each family, you can see what they scored on that protective factor. Note that in this example, family 3 did not complete the last section, so we only have the scores for 4 protective factors for them. Looking at the families together, you could look at the data in a couple of different ways. Going row by row, you can find the average for each family, as you can see in the last column on the right. Note that for family 3, the average was calculated dividing by 4 rather than 5 for the 4 sections they completed. Looking at the data in columns by protective factors, you can tell a different story. What you can see here is a group average by each protective factor. You add the scores from all of the families, then divide by the number of families who have a score for that section. For this group of 4, the average family resilience score is 3.2. The average social support score is also 3.2. Note that for the parent, caregiver, and program staff relationship protective factor, the total score is divided by 3 families rather than 4. You can learn more about the culturally responsive measurement tool, protective factors, by following the link in the QR code or in the intro to this video. The links take you to the Best Starts for Kids blog, where you can find the most up-to-date information about the tool and the resources available to support using the tool. That includes additional videos, a scoring calculator, quick guides, translations of the tool, and much more. Thank you for the work you do in the community to help families thrive.